And thanks to you and Ranking Member Cassidy for this hearing. To our witnesses, thank you all, not only for being here, but for the very important work that you do. Dr. Swan, I want to start with a question to you, just taking a step back. A lack of affordable dental options can result in patients skipping visits to the dentist, which can ultimately lead to even more expensive long-term health care challenges. So what is the impact on a patient's long-term oral health when they skip regular visits to the dentist?
Well, we see that actually from COVID. The problem exacerbates. It just gets worse. And so therefore, the amount of money that's going to take to save a tooth is going to quadruple, or it's going to end up with an extraction, which has been the solution for a lot of people. Just take it out, because I have 28 or 32 of them.
Right.
Yeah.
Yeah. Okay. So worse oral health, more expensive remediation once they do come to the doctor.
And not just worse
oral
health, but systemic health.
That's right. Okay. So, Dr. Minter-Jordan, some employers don't offer dental benefits, and Medicare and Medicaid often provide little to no dental coverage for adults. As a result, nearly 70 million adults in the United States don't have dental coverage. Many families who have health insurers through their employers want to purchase standalone dental coverage through their state's insurance marketplace. However, while this is possible with some state-run marketplaces, depending on the design that the state decided to use, families can't purchase standalone dental coverage in New Hampshire and the 31 other states that use the healthcare.gov federal marketplace. So, understanding that the dental programs that are on the marketplace are vetted and people can actually compare what coverage is actually there, what would be the impact of allowing adults in New Hampshire and 31 other states to enroll in standalone dental plans on healthcare.gov?
Thank you, Senator Hassan, for the question. It is clear that when people have access to dental coverage, they use it. And so what we would expect from that increased access through the marketplace and the ability for individuals and families to purchase it through the marketplace is increased access to care, increased access to prevention, and reduction in overall healthcare costs, given the correlation between oral health and overall health.
Well, thank you for that. I have a bill with Senator Marshall called the Increasing Access to Dental Insurance Act. It has 8 bipartisan co-sponsors, including Senator Braun, which would help fix this problem, allowing people across the country to access the vetted dental plans offered on healthcare.gov. And Mr. Chair, I know there's a markup next week that's focused on reauthorizations, but I would just urge us to see if we can fit this bill into an upcoming markup because it's a straightforward way to improve coverage around the country. Lastly, I wanted to just build on what Senator Murkowski was talking about. Last year, New Hampshire expanded Medicaid benefits to include dental coverage for adults. However, I'm hearing, as you know, on a smaller scale, obviously, than Alaska, but New Hampshire has its rural places too. It is still really hard for people to find a dentist who takes Medicaid and is seeing new patients, especially in rural areas of New Hampshire. So, Dr. Simon, building on what the conversation you all just were having with with Senator Murkowski, what can we do to help dentists practice in places where they are most needed?
So, as many people have said, of course, Medicaid reimbursement is a big, important issue for dentists trying to care for Medicaid patients. But across the country, if you look at the rates of Medicaid reimbursement in different states, it is not correlated with the number of dentists who accept Medicaid. So I would argue there's also something else going on. Providing more funding is always great, but there has to be a culture shift as well. To a certain extent, rural dentists are graying. There are actually decreased rates of rural dentists because dentists in my generation are less likely to practice there. I think the DHAP model is an amazing one that has shown that listening to communities and letting them lead the way is absolutely how we should be providing healthcare. And we know that this can work in the lower 48 for sovereign tribal communities, but also for Americans all over the place. We also know that for private practice dentists who choose to work in these areas, employing a dental therapist can increase their bottom line and allow them to care for more Medicaid beneficiaries. So I think it's a very amazing free market solution to this problem. On top of that, I would argue that having better infrastructure in our community health centers and recruiting more dental students from rural areas, as West Virginia has done, does show that it could make a small dent in making these communities better served.
Well, thank you very much for that. I have talked to dentists in New Hampshire who are graying and want to retire, but they don't know who's going to follow in their practice, so they're keeping at it because they care about their patients. But at some point, we have to find better ways to solve this problem. So I thank you all for your work, and thank you, Mr. Chair.
Senator Tuberville.